Hello, Dr. Pincus. This is a continuation from my last video to complete the comparison and contrast portion of the assignment. I have also included another research article that I found to be quite interesting and relevant to our subject matter. The ACA Code of Ethics regarding informed consent is very similar, if not identical, in several areas of the Ohio informed consent laws and rules for counselors. Both governing bodies state that the counselors are to inform the clients of the extent and nature of services, as well as the limits, rates, opportunities, and obligations associated with services, which then might affect the client's decision on starting services or continuing services. Both governing bodies set out that counselors will take necessary steps to ensure the clients comprehend the consent by providing a detailed verbal explanation or arranging for a qualified interpreter or a translator as needed. Also, if a client, because of age or mental condition, is not competent to provide informed consent, the counselor will then obtain consent from a parent or guardian or court-appointed representative. Now, when looking at the West Texas Counseling and Guidance Agency, it appeared that they used the ACA as their framework to complete the 15-page informed consent and confidentiality policy. There's very little missed in their policy that is not covered in the ACA Code of Ethics. Ohio state laws and rules, in contrast, does not mention much about counselors' duty to warn, HIPAA rights, or how consents are to be transferred to another therapist in the case of incapacitation or death of the current therapist. Both the WTCG and the ACA had clear guidelines on this circumstance. We in the medical and counseling community have a duty to ascertain the proper consents before treating patients. It is important for patients to understand and agree and approve the course of treatment that the healthcare professional is presenting. The concern that is brought out in a paper called Informed Consent, Moral Necessity or Illusion, 2001, argue the practical points of comprehension of the risks and benefits of a proposed therapy or procedure. Have healthcare providers done an adequate job in making sure that all the barriers of communication have been torn down so that our clients and our patients can understand the very nature of the procedure and feel as though they are making an informed decision? One conclusion of this paper reports that that effective training and communication skills can make a genuine difference in the success of clinicians and help in educating their clients and their patients so that they feel as though that they're making an autonomous decision. Thank you.